Good morning, everyone, and happy Monday to you. If you're in New York today, it's a rainy Monday morning. But thank you so much for being here. Thank you so much for tuning in. We have been having a conversation over the last couple of weeks about social work power. And on Wednesdays, our conversation continues about social work or the transformation of mental health through social work. So today, and we've also had the second session already of our social work power certificate course, which runs on Fridays from 3:30 to 5. And there have been a lot of really dynamic conversations that have occurred in those courses, as well as in conversations that we've been having with a number of social workers already about what it means to be a social worker. How do you see yourself in the place of what power is for you? And we've had a number of conversations, which is going to lead to the part of the article that we're going to read today, but a number of conversations about things like our role in policy and politics, and how we, as social workers, show up in the world in terms of where our how we communicate about who it is that we are, how we acknowledge who it is that we are, the kinds of conversations that we have with people, what our self-care even looks like. It came up as part of the conversation, where if we're not doing things that are demonstrating our value and our strength and our power, then how is anybody else going to see those things? And so we've had these really rich conversations about what this means. And in all of that is this idea of social work and social work leadership. And what does leadership look like for us who have been in the field for over 20 years, people who've been in the field for over 40 years, and people who are just beginning to emerge into the field? What does leadership look like in social work practice? And what's been interesting in those conversations is that when we've been talking about leadership in social work with a number of different individuals, there is and I think this was a transition for me as well, there's a tendency to talk about leadership in the context of the organization you work in or the committee that you might be a part of. But that leadership is mostly about much more of a isolated or insulated role or community, because it is happening in the context, or how we think about it is happening in the context of the organizations that we work in. And we think about, and the other part of that is that when we're thinking also about social work leadership, or when we're thinking about things in the context of our organizations and leadership, it's not always about the social worker. It's about who's the leader in the organization. And we know in some organizations, it's not necessarily a social worker. So who do we have to really look to that is a model or demonstrates leadership in the big L of leadership, where it's where there is someone who sort of represents who it is that, and who and what it is that social work is as a core of who it is they are, and leads from that place in whatever environment that they're in. And of course, much, much bigger than the individual organization that they may be working in. So we're going to look at a little bit of this article that we have been reviewing so far. Here we go. Which is the role of social workers in transforming mental health. And we've read up to this part here. And so this is what we're going to be covering today, this paragraph right here, which is what we've sort of been talking about already in this conversation that we've been having. So social work leadership is essential because it provides a guiding force in shaping policies, practices, and programs that genuinely address the needs of individuals dealing with mental health challenges. So I'm going to take this a little bit further and say, it is about of course, about policy and about all of those changes, but also it's about, when we think about leadership and we think about who it is that we get to look up to, model after, who becomes sort of the spokesperson for our profession, that is about us as a profession, which then allows us to take on those leadership roles that we know that we can, so that we can do things around shaping policies and practices and programs that really do speak to the individuals that we need, that we are called to serve, and isn't just about the organization's need to fill a funding purpose or to become or to remain relevant. That you are relevant when you are really addressing the needs of the people who need them, and not when you are doing both at the same time, where you're addressing your needs and somebody else's, because the and gets lost when it comes down to it, right? And so, and many of the populations that we serve, the voice gets lost often. So being able to serve the needs of the people that we are called to serve requires that we stand, and that we really do ensure that we are seen as social workers and as leaders in the field, so that then we can also stand beside our patients and clients, so that they can charge the force also. By advocating for We're here now. By advocating for effective policies, promoting awareness, and facilitating collaboration between various stakeholders, social work leadership can contribute to creating an environment that supports mental health and well-being for all. And so this is what we have been talking about so far, is that it is about, there's a bigger picture here when it comes to social work leadership, and it is not just about the organizations that we work in, or the ways in which it's not only about that. There is something else here, and part of it is that how we sort of show up as leaders, and how we then use that as an opportunity to create pathways for effective change that really, really does target the needs of people, the needs of the people that we serve. And then also, those key stakeholders being the people that we serve. So that is it for me. I would love to hear what your comments are. Please put them in the chat below. Please also consider joining us on Fridays from 3:30 to 5 for the conversations that we've been having about all of this. And we look forward to seeing you there, seeing you soon. And please do make some comments and let us know. Have a wonderful, wonderful day, everyone.